Have you ever felt a sharp pain in your belly and wondered what it could be? Today we're diving into a common cause of abdominal pain that often leads to emergency surgery: acute appendicitis. It accounts for over 250,000 surgeries each year in the United States alone. But what exactly is it? And what are the signs you should never ignore? Let's explore the key facts about this medical emergency. First, let's look at the anatomy. Your appendix is a small finger-shaped pouch that projects from your large intestine, specifically from a part called the cecum, located in the lower right area of your abdomen. Its exact function is still a topic of debate among scientists, but when it becomes inflamed and filled with pus, it leads to a condition we call appendicitis. So who is most at risk? While appendicitis can happen at any age, it is most frequently seen in people between the ages of 10 and 30. There's a noticeable peak in incidence during the late teens and early 20s. Although it's less common in young children and older adults, it can be more difficult to diagnose in these age groups, sometimes leading to more severe outcomes. Recognizing the symptoms early is crucial. The classic presentation starts with a dull pain near the navel that gradually moves to the lower right abdomen, becoming sharper and more intense. Other common symptoms include a loss of appetite, nausea, vomiting, and a low-grade fever. Doctors may also check for specific physical signs, such as Rovsing's sign, where pressing on the left side of the abdomen causes pain on the right. The psoas and obturator signs, which involve specific leg movements, can also indicate irritation around the appendix. To confirm a diagnosis, doctors rely on more than just physical exams. Imaging tests are essential. A CT scan is often used to get a detailed cross-sectional view of the abdomen, clearly showing an enlarged and inflamed appendix. An ultrasound, which uses sound waves to create an image, is another common and less invasive tool, especially for children and pregnant women. If left untreated, appendicitis can lead to serious complications. The most dangerous is perforation, where the inflamed appendix bursts, spreading infectious material throughout the abdominal cavity. This can cause a widespread infection called peritonitis, or lead to the formation of a painful collection of pus known as an abscess, both of which are life-threatening. The standard treatment for acute appendicitis is surgery to remove the appendix, a procedure called an appendectomy. This is most commonly performed using a minimally invasive laparoscopic technique, where a surgeon makes a few small incisions and uses a tiny camera and specialized instruments. In more complex cases, such as a ruptured appendix, a traditional open surgery with a larger incision may be necessary to clean out the abdominal cavity. In summary, acute appendicitis is a serious medical condition characterized by inflammation of the appendix, primarily affecting adolescents and young adults. The classic signs include migrating abdominal pain, fever, and nausea. Prompt diagnosis through physical exams and imaging is vital to prevent severe complications like perforation. The definitive treatment is the surgical removal of the appendix. If you experience these symptoms, don't wait. Remember, this information is for educational purposes only and is not a substitute for professional medical advice. Always consult a qualified healthcare provider for any health concerns.